Wherever can I get it to work? So July 10th, Children's Hospital 2025.
No, you sit here and hold Amari for me.
Like where?
Right here, so he doesn't go nowhere.
Right here?
How do I lift this really up?
You just have to like pull out the bed.
Back
So that.
You're fine.
More?
Yeah. You know what? I can also, if you just want to step on the scale, I can watch it.
Okay.
Yeah, yeah.
Okay.
Hey, sweetie. How you doing?
It's 78.6.
No, then she picks them up and then they weigh.
Okay.
So I'm gonna get rid of the scale.
Awesome.
Get this out of the way, and then I can come back and chat.
Then they subtract it or something.
You're okay, baby. Oh, am I in your way? Okay, I'm in your way. Sorry.
What?
Sorry, don't do that.
Oh, yes, that's
Don't take on his
Yeah.
feet,
right.
Mama.
The way that everything and then
Because he
they
doesn't like that.
subtract backwards and then put it out to see what's left. Yeah.
Mommy, stop doing that. Get down.
I have money.
Sit with Andre.
Did it already happen?
Yeah.
Oh.
Okay.
Okay. Well, that was fast.
Hello. Hello. Handsome.
He's a handsome boy. You got something on your neck though. What is that? Oh, sorry. Oh, good. I did it. You're so handsome. He's so handsome. He's really cute.
Yeah. Mom.
Like,
Yeah.
Friends, like when you see like
He's got a
kids
real
who have, like,
personality.
Oh, mommy. Mom.
He's so cute.
Mom.
Okay, sit.
Tell me.
Come in, please.
Okay.
Okay, I need to see this woman.
Hey, that's okay. Is it easier if I stand?
No, you can move your. It's the stroller.
Yeah.
That's in her way. Mom, I can't move the stroller.
No, we'll switch seats.
That's what she. Yeah.
Okay.
Hurry.
All right.
Stop.
So how have things been going with the eating at home with Amari?
He loves to eat.
Good.
That's not the problem.
Okay. What do
So
you?
here, what I've done, I've been basically writing down since the 3rd,
Okay.
just so that we get a real good idea of where the gaps are.
Okay.
This is my grandson.
Hi. Nice to
We
meet you.
want to give credit where credit is due.
Yeah.
Andre's really good
Nice
at
to meet you,
not only
Andre.
feeding Amari,
Mhm.
but also with the texture of the food, and he's getting more creative with how he's blending things together, and he's getting more aware we need more calories. He's going, okay, so,
Okay.
all right? So,
Why don't you just pass it to her so you don't have to read it out loud?
no, because I'm gonna just discuss it quickly, right?
Yeah. I can also, if you're okay, after I can take a photocopy so I can have that on the record.
Oh, okay, if you'd like, sure,
Yeah.
that's not a problem. So, okay, so he had a seizure, you're aware of that, right?
Yes. Yes.
All right, so what they did is they gave me 3 cans of Pediasure.
Yeah.
And we
how
did
did that
half and
go?
half, like, we broke it up, right? So based on what I did here in a nutshell, I think I do want them.
Okay.
I'm not exactly sure how much they're constipating him at this point,
Okay.
but we'll cross that bridge when we get to it.
Okay.
And I don't want them at 5 to 7 a day, but anywhere between 1 to 3 perhaps.
Okay.
And that's just as fillers
Yeah.
between what him and I are doing,
Okay.
okay? Because it gets daunting,
Yeah. Yeah.
right? And you get these little legs, eh?
Mhm.
Okay? So 10-15 on the 3rd, a half a can of Pediasure, 4 ounce milk, that's 8 ounces, right, combined?
Mhm.
Okay, and then by 11-15, 1 store-bought pudding, another 3 ounce milk. So he only drank, I guess he only drank 4 ounces or whatever, or 5 ounces.
Okay.
And then we gave him the rest of the milk,
Got
right?
it.
Okay. And then by 1 p.m. he had spaghetti, chicken, and I'm like trying to give him meat almost every day now, right?
Okay.
Okay, more than once even.
Spaghetti with like a meat sauce?
No, the spaghetti was tomato sauce
Okay.
with chicken breast.
Okay.
Tomato sauce, whipping cream for texture, 1 cup food, a half a cup and stopped, okay? Because he, I don't know, he had to poo. So with the poo came the frustration and discomfort,
Yeah.
okay? And it got to the point where he just actually even stopped eating there for a day. And then of course, and when you get into that situation, with it being hot in the house as well, you're concerned about dehydration
Yeah,
more than you are the food.
totally,
Right.
absolutely, I understand.
Okay. Because he was pushing,
Yeah.
right? So he stopped eating because he was pushing. He drinking milk instead and finished 5 ounces. Okay? And then 2 p.m. offered food and he ate the other half, okay?
This is the spaghetti again?
Yeah,
2
that
p.m.?
was the other half, okay?
Okay.
So sometimes we have to do that, right?
Yeah.
Whether it's 10 minutes, 15 minutes, half an hour, whatever, okay? It's all hit and miss, right? And also another 8 ounces of milk, okay?
Okay.
Are you writing that down? Because I will let you photocopy.
Yeah, I will
Okay.
photocopy, sure.
Okay, and then at 7 p.m., so there's the gap.
Mhm.
Okay, there's the gap, eh? Now, maybe because he was sleeping, maybe I was sleeping, or they went to play. Okay, offered chicken, spaghetti, zucchini. 1 small zucchini puree with rest of spaghetti and chicken plus 3 tablespoons butter, right? Okay, a few bites, that's all, because he had to poo.
Yeah.
Okay, that's the issue, right?
Yeah.
7:30 to 8 p.m. in and around that time, added plum jelly. Right, you can try and trick them now, eh?
Yeah.
For taste, and only ate a few more bites.
Okay.
Okay, 2 bites, yeah,
Okay.
alright. And then, I don't know if that's going through,
It's going through.
well, I can't see
You
it.
start here. It says 10:10 p.m.
Medicine, okay, and ate half of chicken zucchini and spaghetti and another 8 ounces of milk.
Okay.
Okay, so he ended up, that's how long it took for him to finally eat that, right?
Okay.
Okay. And then the next day, at 10:15 in the morning, woke up Amari. So some days he's up at 5 in the morning,
Yeah.
some days he's up at 10 in the morning.
Yeah.
Okay?
Yeah.
You have a question?
No, I was just gonna say, I think, do you feel like, the one day is like a little bit representative of what he would normally eat? Cause also I'm gonna take a photocopy so I can look at it
Yeah,
later.
okay.
If you wanna review, totally fine, I just wanna be respectful of your time as well.
Yeah, Mom, you don't have to
Well,
sit there and
no,
read
I
the
do,
whole thing.
I worked really hard on this, even though it looks like
No, all good.
chicken
You
scratch,
share with me
and
whatever
plus,
you want,
plus he's here, we can discuss it, okay?
sounds good,
Because as I was doing it, I would see the gaps,
got it, okay,
right? So,
absolutely, let's
right,
keep going
like,
then.
and then I'm like, okay, why is it, like, at 10 in the morning is a gap, because
Yeah.
we really do the rigmarole.
Mhm.
It's not just simply put it in the mouth, you
No,
have to cook it,
absolutely, it's
clean
a
it.
lot of work.
Right, it is a lot of work,
Yeah.
and then you're dealing with his personality. So, I really want this to work, eh?
Yeah.
Okay, so, and it is only 7 pages, it's not even that, it's just
Okay,
from,
yeah.
we're on the 4th, we're just.
Sure,
okay,
sounds
so
good.
we'll
Keep
read-
going.
I'll read fast. 10:15, woke up, sometimes he wakes up at 6:30 and 5 in the morning, sometimes he's up at 4, anyway, I woke him up at 10:15. Got medicine, 8 ounce milk with vitamin D, okay? And then at 11:15, cause you can't really give him a full bottle of milk and then feed him, you have to give him time for it to settle,
Yeah.
right, that's, right? So, anyway, 11:15, last half of chicken. 2 drops. I give him this sometimes as a supplement.
Is it the vitamin D?
No, he gets his vitamin D almost every day.
Fantastic.
It's a herb. How'd I bring it? Okay?
Oh, echinacea,
Yeah, it's to help just to build the immune system.
yeah.
So I figured 2 drops, he doesn't get it every day, but 2 drops a day even wouldn't hurt him, right?
No, absolutely, there's nothing,
So-
yeah.
No more than 2, eh? He's little, right?
Yeah, I think 2's totally fine.
Yeah, 2 is fine. Okay, So, last half of chicken, cause it was a chicken breast, right, so, you know, right? So you get the other half of the chicken, 2 drops of that, served warm with 1 tablespoon, 2 tablespoons, cooked apple, cause I did, so he got apple, and then it was something else in here, plus 2 tablespoons of maple sugar, okay? 1 small piece of white chocolate.
Nice,
Right, I cooked that with the apple, right?
nice.
We'll try not to over
Hello,
puree.
Ray.
I kinda
I'm a
wanna,
funny house.
everything has to really be, see, this is why I wanted to read it to you, right?
Yeah,
I'm
yeah.
to your house.
Tisha just fed him some food and we were rushing this morning, so there was a chunk of chicken in it, so he gagged in the waiting room. But instead of having,
Thank you.
instead of having the food so finely pureed, like a long time ago, before they gave me the drinks, I used to just smash his food with a fork, and he was somewhat able to eat it.
Okay,
But, you know, the gagging would happen every now and then. Anyway, since the blenders came and they get this really fine pureed food, I'm wondering if that is maybe interrupting with the digestion of his food when it comes to, you know, roughage.
it shouldn't, because the blending doesn't impact the fiber. Like that still, it doesn't really do anything in terms of like, yeah, it shouldn't impact the digestion. Like that would be a pretty,
You think so?
yeah,
So,
because a lot of, like people will have a variety of different textures of food, because it's not really the texture of the food as it goes into the mouth that matters. It's more things like the fiber content. Is it more of a like, is it a carbohydrate that takes longer to break down in the gut, or one that breaks down really quickly? And all of those, like that particular property is not impacted by blending.
okay, so at that time I was thinking maybe I could half puree the apple where it was a little more roughage, right? Like
Okay.
more, you know, bulk.
Mhm.
And try and get him, because he'll chew on a nipple, but he won't chew food. So, but you're saying it doesn't matter.
It shouldn't matter, and I think whatever is easiest for him is probably the best texture to go for.
Okay, leave apple as more roughage, so all right, I put question marks here, so that's why I wanna read, because I
Yeah,
was
yeah,
wondering
totally.
about that. And then refuse to eat, not feeling well. So all that food that I prepared for him with loving care, he didn't want it because of the pooing.
Yeah.
That was what was interrupting with it, okay? That, it turns out that little piece of white chocolate.
Yeah.
For the calories, that's all.
Yeah, absolutely. I'm a fan of chocolate. So
Yeah, I
sounds
figured
good.
white was better than, like safer in terms of, too much chocolate can bring on seizures as well, right? So I figured the white maybe not so bad as the dark, I don't know.
I've not heard about chocolate causing seizures. Like he's probably fine with
If you
either.
eat too much.
Okay.
If you
That's
eat
what it
for-
says on Google.
Yeah, if you eat too much for some people. For some
Interesting.
people.
I have not
Yeah.
heard that before.
So I use it, you know, within reason,
Yeah.
right? Having to push off, having to push off and on to poo, very difficult for him, blah, blah, blah. Okay, medium, small stool, he ended up pushing out a small one, okay, whatever, as well as very diarrhea because of the laxatives, right? Because, you know, still from the hospital and gave more at home and.
Yeah.
Anyway, 2 p.m. gave ginger ale, because now I'm concerned about him getting dehydrated.
Yeah.
Because my house is extremely hot as well.
Yeah, I bet.
Right, so
Yeah.
I'm not just battling one thing, I'm battling more than one,
100%.
right? Okay. Drank 4 ounces. Tried to feed him again. I had to sing to him that time, so he wouldn't take it for him. So I took over, and then I just started singing my goofy songs that I sing to him.
That works?
Yeah, it did.
Fantastic.
Yeah, it did. Had to sing and be playful, and he started to eat. 4:15, ate all his food and extra applesauce. Okay, so there's that. And then had the rest of the ginger ale. So it took me singing And that was at 2 p.m. Then we have, no, that was at 4:15. And then at 8, right? He had mashed potatoes, cabbage, and asparagus, which came from downstairs because my son will send up food upstairs.
Okay.
So he also gets that, right? That's whenever it's not too spicy. Corn, beef, all blended together. About 1.5 cups of food, 8 all. And a little applesauce as well, and an 8-ounce ginger ale.
Oh, get
Yeah.
a pot boy.
Mm-hmm.
Okay? And then he had his medicine at 10 p.m. All right. And then, you know, like, we do give him water and he plays with it. And so, you know, I mean, sometimes I'm sleeping by this time because I often get up at 3, 4, 5 in the morning.
Yeah.
So Andre kind of, like, you know, he may give him water, might give him milk or ginger ale or something. So I don't get each and every what, but I've been writing as much as I can. So July 5th, everyone slept in late, okay? 11 a.m. medicine, a half a cup of Pediasure, so I guess that's when I really started to introduce it, okay? And 4-ounce milk, so that was an 8-ounce bottle. And then at 1 p.m., offered oatmeal, hemp seeds, maple sugar, whipping cream, and only ate half of it, okay, a half cup of whatever was presented to him. Kept trying to give other every hour or so, but wouldn't eat. Provided ginger ale. And then he had run for 3 days. He had the runs. Then Amari had a very large poo. Okay, so that's why he probably didn't want to eat.
Yeah.
And then I put in here in brackets, had runs for 3 days because of the amylax.
Yeah.
I don't like that stuff, I really don't.
Sit nicely, boy.
I like using plums,
Mhm.
Stewed plums, puree,
Yeah.
and spinach. But right now, I know that I can only be in the kitchen for so long, and when I'm
Absolutely,
doing,
yeah.
right? And you gotta be like, you need a proper, like, you need 2 fridges, you know, just.
It's a lot,
Yeah, you do, but the next shop, he's gonna go get me spinach,
Nice.
and I've got stewed prunes at home, we just have to grind it up, but I find if I work with them within a certain kind of balance, it
And it
works
works for you.
without having to, but yeah, if you go over the edge, then especially with the spinach, it can really bring on the diarrhea. So there's a fine balance there.
Yeah, one thing I was gonna mention about, so with constipation, whether you're using the food or whether you're using the Amylax or whatever method you're using, what can happen when you get really backed up and it's taking a long time for you to poo, once you start giving something to like help with that, it is pretty normal for the first little bit for it to become diarrhea.
Cause yeah, it does it on the outside, it
Exactly.
softens it, but not the inside.
Exactly, so you get this overflow diarrhea, and then sometimes you actually have to like get them fully cleared out. It's gonna suck for a couple days to get everything out, and then like reintroduce.
Hello.
It'll come in a minute.
Okay, and so,
What do you mean reintroduce?
well, what I mean is like, that's not the right word. So the goal, and I know it's really challenging with most of these kids, not just Amari, is to have, not to get to that point where now you have to act to clear him out. Because you kind of go through this cycle of him getting backed up. Amari. Oh, buddy. Hello.
No, you're not flipping off the table yet.
Oh my gosh.
One flipping out of the chair, the other one
Okay,
flipping off the
sit
table.
Okay.
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 Sit nicely.
And so just so you can avoid that cycle, and that's not an easy thing.
No, it's not.
No. So for some people, it's medication and it's like working with the dose, and sometimes it's like a very small dose, like a teaspoon every other day. For some people it's food, but what matters is like the consistency of finding one thing that he gets every day that keeps him regular. And I'm happy, if you're saying that the prunes work for him, work better than the medication. That's great.
My concern about the prunes is that if you give too much, and plus he gets prune juice sometimes too, it makes him gassy. Yeah, the prunes can make them gassy, so I can't, it's not that I can't rely on prunes every day, whether it's the juice or the fiber, whatever.
Yeah.
Or even spinach is, is.
Yeah.
Okay, so you're saying, so now that we know that you can make them gassy, disregard the gas and, but, I mean, like.
Or if it's not prunes, if it's something else like the plums, like if the plums and some people find like kiwi works better, or I'm not saying I'm not.
No. I'm thinking like,
yeah.
Can I not? Okay, like we did give him like a tablespoon of Emalax here and an Emalax there.
Yeah.
Every second day, we're gonna get into it where we say he got a tablespoon of Emalax. Not the laxative, right? Relax or whatever it's called, right?
Hey, he's screaming at you. You need to move from him.
Yeah.
So if I give him a tablespoon of, because that's what they've been told. Some people say give them a whole freaking full cup.
It's different with everyone.
Every day.
So some people it's like a quarter teaspoon
Yeah,
is
but
what
I'm
works.
saying other people tell me give them 3 tablespoons a day every day. One person will tell me a tablespoon every. You're saying a teaspoon.
What I am saying is it's different for every kid.
Yeah, I know.
So what I
or
always
use as needed.
What I don't recommend use as needed because that gets you into that situation of him getting backed up and then having diarrhea and then getting backed up and then having diarrhea again. What I'm saying is if you want to use the medication, what I always recommend start with a small dose, like 1 teaspoon, half a teaspoon, and then if that's not working, then increase. So
Every day?
And then yeah, it's just like it's hard because basically it's like you have to do science experiments at home to figure out what is the best dose for him. Because there is not one standard dose that's gonna work for every kid.
Is it better in the morning? Better in the evening?
Usually best in the morning.
Best in the morning.
Usually best in the morning.
Okay.
Taken first thing with a good amount of fluids.
Okay.
And on
an 8 ounce, we can get him to drink that, no problem.
And it's on a consistent basis. So whether it's every day or every other day. So I would rather him have a small amount every day or every other day than to try to use a big dose when he gets backed up.
So when you say small amount, instead of a tablespoon, we should be looking at a teaspoon.
Maybe try a teaspoon. If you found that the tablespoon it makes it like too much.
Well, he's not pooing. It doesn't matter.
It doesn't matter. It doesn't work if it's a tablespoon.
Well, I don't know how often you expect him to poo. He can go 3-4 weeks without pooing.
He should poo every day.
Oh no, he ain't pooing every day.
Yeah.
It doesn't work like that with Amari. I don't think even no matter how much laxative you give him, unless you want him to give him the runs 24/7.
Yeah. The other thing.
That's an issue right there.
Yeah.
I can't see your face.
And that's based on my experience with him.
Totally, 100%.
Yeah.
The other thing I am wondering about is his overall fluid intake.
Oh no, he's getting lots of fluid.
Is he? Okay. Like
Well,
how much do you think in
Well, I'm telling you how much.
Like, is it like more fluid than like eating? He's always
he's
drinking. I don't know. When I'm at my house, like I give him like what? How many bottles of chocolate milk, whatever. Like we'll be chilling.
Yeah,
Like
he's
and
not,
it's
he
like full
also,
bottles too.
he also Andre also gives him juice even when like, it's not with meals, he's always getting something with a meal.
Yeah.
Okay.
Right, and then we offer him water, but there's no guarantee that he will drink the water unless he really wants water, right?
Yeah.
And then there's cranberry juice, Tang, or apple juice, or ginger ale, but like, what are you suggesting in terms of the amount of bottles, 8 ounce bottle of liquid that I should be looking at?
Well, at his
Yeah.
probably about, and I work in milliliters, so let me just do the conversion.
Yes, please.
So like 1.2 liters, which is gonna be about 40 ounces.
40 ounces.
So like
So how many 8
5.
ounces divided into 40?
5.
Oh, he gets more than that.
equals 5 bottles.
Yeah, of course, yeah.
Okay.
Well, more
Well,
than
I would think so,
Yeah.
no less than 4
Okay,
in a
okay,
day, but I
okay.
don't, that.
It depends. Like he's always I swear, this boy always got a bottle.
Yeah,
Okay.
yeah,
Okay.
but that doesn't always mean though, Tisha, that he's drinking every last
Well, I
drop.
know. I don't think you drink it and.
Yeah.
But normally he's really pretty
I don't think you
good,
drink the one in
right?
the car.
So
Okay.
we're looking at 5 8-ounce bottles a day of
Yeah.
something.
Something.
So does it matter if it's milk or does it have to be,
No,
right? It's
any,
just-
any fluid.
Okay.
Yeah.
All right, well, we do mix it up, so that's good to know.
Okay.
All right, and you figure with that amount of quote unquote liquid, that will help with his stools.
Or, you know,
But
maybe he needs more. I don't know. It's hard because I wish that I could give you a formula and be like, this is what's
yeah,
gonna work
I know
for him.
that. I don't, trust me, I know.
Yeah.
That's like you judging me and I'm judging you, as if anything's gonna come from that. And
No.
nothing coming from that. What's coming from it is this what we're working on here, right? That's where we build in.
Okay, let her photocopy it because Dr. Mulfrey tried to come in, some other person tried to come in. So I think she got a gist of everything, a photocopy. What is she?
Whatever.
Yeah.
Well, no, because we're talking about things that are important here, Tisha.
Well, I know, but
I've only got a couple of more days left to talk.
Yeah.
But she can see the variety. Well, there's so much variety in there. It's like,
Right.
yeah, no, it's really good, Mom.
Okay, well, sorry, I'm blind, I don't see very well, so if
That's
you notice I
okay.
have to use this, okay?
No, all good. And your writing I can read is perfect. That's fine.
Mm-hmm.
So this all looks fantastic. Like just, you know, what you're telling me right now in terms
I have
of
it
the variety of food that he's getting,
I got it.
you know, the amount of fluid, that's all great. I do still have a concern about his weight.
Well, we all do.
Yes. So I do want to talk to you, and I know you guys have been working so hard to make sure that he
Okay,
gets enough.
get to it.
I want to talk to you about a G-tube at
No.
this stage.
No, because he eats. What we can do.
The thing is, he's so active. He's gonna rip it out.
He's gonna rip it out.
He's gonna
like,
rip it out.
it
There's
will
no
just-
there's no place that you can put it because
We have lots of kids who get them that have ways to keep them
Okay,
in.
so what is the benefit of that? Because you can just we can just do the Pediasures again.
Okay.
How does, because I was told that whatever you're putting in these feeding tubes is the same thing that's in those drinks, basically.
and one of the drinks that we got, it wasn't like a milk base. It had like meats and vegetables in it.
Yeah.
Okay, right, he eats, he drinks.
Yeah.
That is not the problem.
Okay.
So.
What are you feeling is the problem? I guess is my
It's
question.
this.
Well,
And
I'm
he's so
wondering,
active.
Yeah.
well, that too. I'm wondering, okay,
Okay.
he's got brain damage.
Mm-hmm.
I thought maybe he was allergic to fat, like couldn't digest fat, but the dietitian at the children, at the Surrey Memorial when he had a seizure, said that if he was allergic to fat, his poo would come out looking oily.
Yeah.
Okay, so that's removed that from my mind. With whatever he's got damage in his brain, his right side has always been thin compared to his left side. Right,
But he uses
And
left
then
side
something-
more.
and then something changed. We all know that the brain changes as they age. So maybe that's what we're facing here.
Yeah.
Maybe that's what's affecting his weight. Maybe whatever it was preventing him from gaining weight on his right side. Because it was as plain as day,
Yeah.
okay?
Yeah.
I'm sure you've noticed that in children like him.
Mhm.
Maybe it's on both sides now.
Mhm.
Or I read something, I don't remember how I came across the article, but somebody had something wrong where they couldn't gain weight. And they did a bunch of tests on them and it was something wrong with a part of their intestine. So they had to remove it, and once that part was removed, they were able to gain weight.
Okay. Can I ask you a question?
Yeah,
Has he been seeing his pediatrician, Dr. Ramesh? What does he think?
Yeah, well, I'm seeing him next month. He said overall, like, you can see how happy and active he is, right? He said he's a little bit concerned about his weight, but then also because he's so active, it's like he doesn't sit still. So I was like, what do you do?
Yeah, so this is where, and again, it's no judgment, it's not up to me, I'm just telling you what
Yeah.
I've noticed in other kids that are very similar to Amari. where one, they are very active, they are very, like their muscles are very tense, like they just have a lot
Yeah.
going on.
Yeah,
To the point where even though they love eating and drinking and they eat a lot, they just cannot physically eat enough to keep up with that.
so are you not filling up the belly by putting it in there?
So what we find is that for a lot of these kids, having the G-tube, and it's not to say he would not stop eating. I just want to be clear.
Well,
clarify
he probably will though, because
No.
when he was taking too many of those supplemental drinks, he just stopped eating.
What I'm saying though is that with the tube, you have flexibility. It's not even that you have to use it every day, or
Oh my
even that you
God.
have to. And I'm not making a decision for you. I just want to present
It's
you
okay,
with
you're
the option.
talking, you're
Yeah.
okay,
Yeah,
you're
yeah.
okay. Let her talk.
Essentially, what families who have kids similar to Amari do with the G-tubes is they use them when they need it, and then if he's having a really good day,
That's like using laxative, you never really know.
yeah. So it could be something
And what's a
like
good day?
yeah. And so it could have been.
What is a good day? What do you constitute as a good day?
Well, I think it would be a day where he's not refusing his food, he's eating what he usually
Yeah, but if
eats.
he's got so full of the G-tube there, full up with all, and he's not pooing, well, where does that stuff come up? Just that way?
Yeah, and the
Yes,
you know what?
No,
that-
she's
No,
just-
this
she's
is-
listening to
this
you.
I'm
is
listening to you.
serious.
Yeah,
Okay, if he's not pooing,
Yeah.
we got the same problem. You're pumping
food.
food into him that he can't eat because there's nowhere for it to go. Where does it go?
and
Is
for
it gonna upchuck?
And I was gonna say, for some people, actually, the G-tube even helps with the constipation because sometimes when kids have, and again, I'm just
This is a
saying,
sometimes, there's no guarantee.
there's never a guarantee. You're absolutely right.
Yeah, it's always like that.
It's always like that. And I'm not saying that you absolutely have to go ahead. What I'm asking you.
Well, I don't think you could make that decision. It
No,
would be a
absolutely, I
fight.
can't. You're
It would
absolutely
be
right.
a fight, because that's not what I want for him.
No, I know. What I'm
And I
saying,
don't see it as a solution. I don't.
I'm not saying that it's a solution. I'm saying it's a tool that many kids.
So
like-
what, you decide to use it on Friday but not on Wednesday?
Well, like the thing is, you probably use them like.
How would you make that decision?
I'm thinking she means like use it every day, but maybe some days less
Yeah,
days.
and
Like
it
less.
could be
And
something
how
like,
much are you putting inside of him?
How
it
much
could be
is it?
something like, again, it varies kid by kid, but it could be something like, for example, you mentioned the Pediasure, maybe it's one
Why
can.
can't he drink it?
Maybe he will, I don't know, but what I'm saying is,
Oh, he will drink it.
I'm saying for a kid like him, because also it's harder for him to eat and drink compared
No,
to
it's
other
not, he
kids.
loves eating.
Yeah.
You don't, no.
Oh no, he drinks. That's the thing is what she was saying is sometimes we overgive it that he doesn't want to drink. He starts playing with it.
Got it, okay.
Yes, so like he had a bottle before he came, so I told Andre to give him the bottle in the car, which I probably shouldn't have because I asked him. It's on my floor, so it might be like leaking on my floor right now. You know what I mean? Because he already had one before we
I
left,
understand.
right?
He eats, that is not the problem.
Okay.
If he's got a poo, that will become a problem.
Yeah.
Who is this person?
My name's
Alright,
Jamie.
he's one of the surgical fellows, he working
Okay,
with
I
I'm
Dr.
work
Lilly.
in Amari.
Okay, are
Nice
you
to meet
just
you.
listening or?
He was trying to come in before, but like obviously.
Okay, that's fine, but why
Yes.
are you here?
Oh, you come in to see Dr. Malpari today?
Yes, I did, is he not here today?
Yes.
He's here today. So
He
you'll
is?
see myself and.
He is here?
Yeah.
Yes.
Okay, so you're here too.
Yeah.
Okay, and your name, sir?
It's James.
James, I'm
Yeah.
Judy.
Nice to meet you.
I'm Amari's grandmother.
Nice to meet you.
Okay, nice to meet you, I just didn't wanna be rude, right?
No, I wanted to sneak
Okay,
in
but
to see you.
Is there something you need to say right now, before we carry on, or you just wanna listen?
You keep talking, and
Okay.
then I'll talk to Catherine, and
Okay.
then I'll come back and see you,
Fair
and then
enough,
bring Dr.
okay,
Malpari.
fair enough, because
Okay.
Andre and I, we give 2,000%,
Oh, I'm not doubting that at
Okay.
all. I'm not doubting
Sit down,
that at
baby.
all.
all right?
Yeah.
And whatever you're offering
Mhm.
isn't anything that he won't take by mouth.
Okay.
And
Well,
that's why
because,
I'm
yeah,
willing, that's why I'm willing to do the Pediasure,
Okay.
because it's not like the last prescription when it came to those supplemental drinks.
The last drink that I'm talking about that they gave her, rather than the milk-based one, it was like meat and vegetables. She said that he probably won't take it. You know what I mean? Because I guess it had a bad taste, and he drank it.
You drank it? Okay.
You know what
Yeah,
I mean?
he likes the Pediasure, that's not the problem.
Okay.
The problem is if you give him too many at one time and it makes him constipated and filled him up and he
Okay.
won't eat.
Okay.
okay? So I wanna use it as a supplement, that was the first thing I said to you when I came in here.
Absolutely, let's do that then.
The whole purpose, I'm very defensive right now.
No, and I
The whole
wanna be.
purpose of me
Yeah.
writing that down was to find the gaps.
Totally, and I'm totally willing to explore that with you.
Yes,
And I'm not saying that this is something, like what I'm recommending isn't something like you need to do this right now or I'm gonna judge you. None of that, okay? I'm
I
just
got enough people doing that.
I know. I'm just presenting you with the options and letting you
You're
know.
not the first person.
I know.
But
And
I don't
knew
see
you were
it
gonna.
as
I knew you
if
weren't
he-
gonna like this conversation, but I had to have it.
If I felt that he wouldn't eat food or had a problem eating food in terms of he was incapable of doing it.
Yeah.
Then I would be on the bandwagon.
I 100% understand. What I'm telling you is that there are many kids similar to Amari who have absolutely the ability to eat, but they're not able to eat enough. And I don't know why.
What happens when the stomach gets full? You didn't answer that question.
Yeah, sorry, we got off track on something else. So we have ways around that. So some kids get fed at a very slow rate overnight. Sometimes we will do a very small amount of formula. Sometimes it's like we find a gap in the day when they're less likely to want to eat and we use that. It varies kid by kid. So it's not a one size fits all.
And how do
solution.
you determine when to feed him? You got me now in the kitchen 24/7,
Yeah.
writing everything down, getting the calorie count to find out that I'm 100 calories short.
It's not 100.
I'm just using that as
Yeah.
an example, 500, 250, it doesn't
Yeah.
matter. I'm short on something where now we need to plug in something
Yeah.
in order to,
So for most
where I'm going
kids,
with that,
Yeah.
because I'm the one doing it, not you.
totally. And for most kids, what I will tell you is that it's not that we're counting the calories. It's more that, and unfortunately, again, I'm gonna be honest and say it's a lot of trial and error.
Well, that's not fair then.
I know.
That is completely unfair and it's unreasonable.
It's the same as with his oral intake as well.
Yeah, well,
That's trial and error too.
it doesn't give permission to start doing that.
And I'm not-
Bouncing around and ripping
She's
it.
not saying
She's
she's
gonna
gonna
get
do it.
infected and then this doctor has to operate because now it's like gone in some major, who knows what's gonna happen with it.
Okay.
The main issue is that
Like
she's
the
gonna
guy,
is
the
like,
little boy is
yes,
happy now.
he will rip it out. That's it.
Like he's so happy. Like, people overlook that. They just
I can see
Don't
that
wanna acknowledge
absolutely. Yeah.
that he has his own little life,
Yeah.
his own little methods, his own little ways. His life expectancy has already been robbed from him. I've been told 45 years, maybe if he's lucky, he might make it to 70. Okay, and like, he's not some, well, it might be this and it could be that and we don't really know and like, right? Like, we got him eating.
Yeah, which is great.
I had to take him off the supplemental drinks to get him eating. Now that we got him eating, and I'm willing to use previous yours, okay? I'll even compromise with you. We'll go 1 to 4 a day. I said 1 to 3. I can put it as much as 4. 5 might be too much.
Judy,
Oh,
can
no,
I
you're
just
stressing me
back,
out
I know,
now.
and I don't mean to, and I wanna back up and say, I hear you, and I'm not saying, like I was saying before, it's not that I'm not saying,
See, this is why you needed to be here, Andre.
I'm not saying that you aren't doing anything or like that I know how hard you've been working and I think this is amazing what you've done so far. I wanna present you with the options.
This is not the first time. Like this is like been ongoing
Yeah,
since
this
he's
has
been
been
born.
since he's been born.
I
Yeah,
understand,
It's
and
like
I
people have
absolutely,
been leading up to it and now, because, right?
and my position is,
You wanna say something?
I don't wanna wait until.
I was just gonna say that I think that everyone wants the best thing
Yeah.
for Amari. Both parties want the best thing for
Okay,
Amari.
and,
And so I think
From
that
something so
Catherine-
defensive.
No.
I think Catherine's coming from a perspective that she's trying to just give you the advice about what from a dietitian perspective can help, but there's definitely nothing
It's
that's
still
being
your choice.
forced.
It's still
your
absolutely
choice.
your
Okay,
Yeah.
Yeah.
and there are no guarantees.
There's, yes.
And it's not like I'm putting my heels in and saying no supplemental drinks, which is equal to whatever you're gonna put in the feeding tube.
So why don't we do
Know how
that?
much calories are in it?
Right?
What is it?
Well, no,
Well,
it's,
again,
it's up for debate.
It depends on the kid.
Exactly.
No,
There-
but like what do you guys feed them in the feeding tube? What is
So,
the cocktail?
So there's multiple options. So it could be
Supplemental drinks.
a supplemental drink. You can also actually blend food and put it through.
I'm
the
not doing that.
Okay.
He eats.
Okay.
Let me
That's fine.
blend the food and put it, you don't eat no more.
Mom, so
Well, no.
Yeah.
she's very
Right?
touchy when it comes
Like,
to
no.
I know.
I'm sorry, you're not fat enough, man. I need to fatten you up, okay? So you don't get to eat no more because I'm just gonna pump it
And
into
I'm
your
not
gut.
saying that at all.
Like, come
So
on.
why don't we, Judy, let's back up.
I'm trying to preserve his quality of life.
Totally. So let's back up. I'm gonna say, let's do the Pediasure.
Yeah.
And I'm not saying, I think, I'm a type of person that wants to present you with all the options. I feel
I've
like
already been informed of those
I
options
know.
long before I ever met you.
I understand. It's still part of my role to talk to you about it. And
Okay.
other people have talked to you
Okay,
before.
it's ambiguous.
They make it down, please.
I
It's
understand, and I
very
wish-
ambiguous because being that he's a surgeon, before you came in, I was talking about maybe other reasons as to why Amari might not be gaining weight, right? Other reasons as to why Amari might not be gaining weight. It doesn't all have to be food related.
Yeah.
I've ruled out, I've ruled out, Leah May, please. I've ruled out that more than likely he's not, what is that?
Allergic to fat, you said? Or like the fat
Yeah,
malabsorption?
it's more than likely he can digest fat. Because if he couldn't digest fat, because he gets a lot of fat, you can see, right?
Yeah, absolutely.
Okay, and we've increased now meat and fish, okay? Some people can't digest fat, so therefore they're not gaining weight. His poo doesn't come out oily, that's been ruled out.
Yeah.
When he was born, whatever, he's got a whole bunch of problems up in here because of lack of oxygen. His right side of his body was always very thin, no muscles, whatever, okay? Very lost, muscle in here, muscle in
Copy
there.
this and come back while you're talking to the doctor, okay?
Sure. Okay?
I think, Mom, you are making her cry.
Sorry.
No,
No, I cry when I'm stressed. It has nothing to do with you.
You're not
Don't take it.
crying.
She is.
She
I'll
can't.
be back in a moment.
You are
crying.
Yes, she is.
It's okay, Judy. You don't need to worry about it. I'll be right back.
I'll be back in a minute.
Yes, she is. You're very aggressive.
Well, yeah, they wanna
It's just that
do
she's
whatever.
giving you an option, and you're screaming at her. Mom.
No, I'm not screaming, I'm being firm. I'm being firm,
You made her
Tisha. Well, then she's just highly sensitive. It will just make her better at her job. It will make her better at her job.
Eat it.
Okay, these are tough life-altering decisions.
Okay, but the thing is,
So it backfires, he gets an infection, things get worse, and then what?
she okay?
Yeah.
She's fine.
Did her notes stay here or?
No, I think
We
she
took them?
she
Okay.
grabbed them. Yeah,
Thank you.
She's a professional, she'll be fine.
I understand.
She
that.
was acting like she was the one that make the right decision, to make the decision.
No, she wasn't.
Mommy,
She
Mommy,
said that
fire.
everybody that we see is concerned about the weight.
Mommy,
Everybody that we have been seeing
Mommy.
keeps saying the
Yes,
same
and
thing.
I'm trying to bring to the table that they should be looking at other options as to maybe why he's losing weight.
He doesn't.
Mommy.
He doesn't.
Mommy,
He loses weight.
Mommy.
For one, he doesn't exercise. Right?
Mommy,
What are you
Mommy.
talking about? He moves around all
But
day.
like walking
Mom.
and doing things like that, and it's a muscle thing, okay? And on top of, it's the calories. It's the calories. Like yes,
Well,
it's a
then we
lot.
have to give him more calories, and that's why I'm
then
gonna
he's
give him.
constipated,
Mommy,
and then it's like it's the same thing. So
Yes, and everything's all a hit and miss.
so
Everything is, oh, that's how they save their butts, Tisha.
they're not trying to save their butts. They're just
Oh,
trying to
Tisha.
make give you options,
They-
and then
they
the option's
can't.
been like this for years, Mom. It's been the same
Yes,
thing for years,
exactly.
and nothing is changing, and that's why they keep saying it. So don't get mad at her or
I'm
whatever.
not mad at her. You see, that's the thing. I'm not mad at her.
Okay, but the thing is, Mom, she's talking like this, and you're talking like this. Okay,
Well, yeah, because she's making it sound like I'm not making the
Hey,
decision.
that's my
Or whatever,
mail.
however she was saying it, as if she had the right to make the decision. What did he throw out?
My mail, Kyrie. Watch Amari.
Right? She's just a dietitian.
Mom, you're aggressive though.
Well, yeah, because they want to now start doing that with
They've
him.
been every doctor said
Oh
that.
my God! Anything that they ever done hasn't done any good anyway, Tisha.
Like what do you mean? Anything
So
that
what?
they have
They gave him the ankle things, and what did it do? Break his freaking tibia, and now his foot's like this, and they want to blame me for that.
Sorry.
No, I didn't do that.
No.
Okay.
At the end of the day, it was supposed to help him. Now his foot's like this. Now
Yeah,
it's all
but whose
gimped
fault
up.
is that? That's that was their freaking ankle things. They're the ones that put those things on him and made him break his
But
tibia.
the thing is, if he had more muscle, more fat,
No,
maybe his
tibia,
tibia would
do
have
you know what
break.
the
I know it
tibia
is. I know
But
what
when
it
you
is.
take a hard piece of plastic and you whack it, what do you think's gonna happen?
I feel like if like that happened to you,
You
would've-
break your
it
tibia,
probably wouldn't.
Tisha.
Mom, look at
That
his
is a
leg.
very
Mom,
fine bone.
I understand that, but look at his leg, and then look at
Yeah,
Kylie's
well,
leg. It's completely different.
Whatever. He broke his tibia and because of the ankle.
At the end of the day, it's okay. Like freaking, the thing
The
was
supplemental drinks, we were giving him them those supplemental drinks and he was losing the weight anyway, but he stopped eating. I got him
No, he
freaking
was
eating.
gaining weight with the supplement.
No, he wasn't.
And that's when
No.
the chart was going up. Yes, it
No.
was. Yes, it was.
Tisha.
I
wasn't.
just gave you the chart.
No, yeah, that's
gave
when
you
he
the chart.
stopped eating, Tisha. He was no,
No,
he was not
that
gaining
mom,
weight.
you haven't given me drinks in
Tisha.
like 4 or 5 months from now.
Tisha,
Harry, stop throwing stuff in there.
he wasn't gaining
Mama,
weight.
I seen it on the charts and the time of the date. You stopped giving it to him like how many months ago? Like 6 months ago.
No, I don't know, but he stopped eating, Tisha. And he
Anyways,
was
just
getting
just do the drinks again. If you
That's
don't
what
have
I
the feeding
want to do.
and like just do like do breakfast, right? Do breakfast, whatever. Do give him 2 drinks, whatever, two of the Pediasures, and then if he's hungry, give him a little something. If not, wait, give him dinner, and then after dinner, give him like 2-3 more. So maybe skip lunch.
No, the food is,
The lunch could be the Pediasure, Mom. That's what I'm
Why?
saying.
Oh
Because
If
it
you
has
can
more
get the-
calories in
no,
like
because
because
you
one
can
is
get the
300
calories in the food, Tisha.
But it's
Okay,
faster to go
I am-
down. That's the thing is a Pediasure, it's easier to take than eating a whole plate of food.
He eats the food, that's not the problem, that's
Harry,
why
stop.
Andre, is it a problem feeding Amari?
Maybe it's not enough.
Andre, is it a problem feeding Amari? No,
No, I understand that it's not a problem, but it's easier to get the calories in drinking than it is
but it's
eating.
not food, Tisha,
That's why I
there's a
said.
difference.
That's what I said. Give him breakfast. Maybe for lunch, give him the 2 Pediasures. Give him dinner, and then if he wants a snack, give him a snack.
I
and then 2
wrote
drinks at
down
night.
what I wrote down.
Okay, you
so
see,
that-
I'm giving you a solution about having 4 drinks a day, and you're saying no,
Well,
no, no, no.
I wrote down
So
what
what?
I
So how?
wrote
So
down
how?
to
So
see where the
how
gaps
are
are.
you going to give him the Pediasure if you're trying to give him 4 a day?
Within the gaps,
sorry, dog.
within the gaps of his feeding, if we
Okay,
can't
whatever,
meet the
Mom.
calories.
Do whatever
If
you
we
want.
can't
The
meet the
thing is-
calories, listen to me.
I already know. You already have your mindset. Okay, you have your
Oh
mindset.
God.
It's either your way or
You
no
don't
way.
cook for him, Tisha. You
Mom,
don't
as I said,
do
it's
these
your
things.
yes, and I'm the one that comes to his appointment, and every time they tell me that he is losing weight.
Yeah, right.
Okay, so the main thing is obviously it's a weight thing. I can see it. You can see it. We're not freaking blind. We're not
Right.
blind.
And it could
he's
be
turning
connected
8
to
years
his
old.
brain.
No, it's not connected
You
to his
don't know
brain.
that.
No, it's not, Mom, because he was gaining weight. He was.
Tisha, no, he wasn't. He stopped eating.
Oh my God, Mom. He was gaining. I gave you the chart.
That's when he stopped eating.
So he was. You know what? It's okay.
Is she okay?
She's-
Hello.
Okay.
She's a professional,
We've got the whole crew today. How is everyone?
James.
James, that's right.
Right, you're in the hot seat now.
So is
Amari.
Amari?
Yeah.
Hey
Can I
Amari, how
finish
you
before
doing?
you start saying what I was saying there in regards to
Hi.
maybe there's.
He's not the dietitian. He's
It
somebody
doesn't
else.
matter. He's a surgeon. He's a doctor. He has a brain. He can think.
Hi.
What did you want to say?
Oh, Jesus.
Hi.
Watch yourself. no.
All right,
Hi.
Clearly-
You can bench
I'm upset.
yourself.
but not
Sorry.
what
Let
you
me-
think as an upset. I'm
Yeah.
worried for my grandson.
Of course.
I've been worried for him.
7 years.
Yeah, there, you got it right. Okay. So we know that he's not. We know that he's able to digest fats because his poo isn't coming out oily.
Yeah.
If I was a doctor, what would I think would be wrong with him outside of not enough calories? All right? And I don't mean it in a snide way, okay? I just am what I am. When, his, all in the front here is damaged, right? So physiologically, his right side has always been very thin
Kylie,
The whole
get
right side.
out.
and weak. His
I
strength,
can't
his
have it.
movement all comes from the left.
Are you gonna get out? Stop.
At one point or another,
Don't come back.
he started to lose weight. And they were piling on the supplemental drinks.
Yeah.
More and more. But with that came not wanting to eat because he was getting full, couldn't poop, whatever. It got dangerous, really dangerous for him. So I had to make a decision. I had to cut the drinks out because he refused to eat food, period, for months, okay?
Yeah.
All right.
Turn it down a
And then
little.
it got to the point where he couldn't even poo, where I had to stick my finger up there and grab the shit out.
Mm.
And I didn't appreciate that.
Sure.
Okay, even with the MLX, okay?
Yeah.
So that's what provoked me to take away the supplemental drinks.
Yeah.
As soon as we did that, within a few days or after he pooed, he just went back to his old Amari self and started eating. That's the joy of his life, is to eat, okay? So, it's, you have to get that
Amari.
calorie count up.
Yeah.
It's not easy.
Yeah.
So what I'm thinking is, obviously, that's why I did what I did for her, so we can isolate the gaps to fill in with the Pediasure,
You gotta be quiet, baby.
right?
Yeah.
An example,
Hello, Mommy.
10 o'clock in the morning might be a good time to give him a Pediasure if I haven't already made him breakfast and ready to feed him, assuming that he's awake. I'll just use that as an example.
Amari.
And then by 10 o'clock, or by 12 o'clock,
Is that happy or sad?
yeah, that's happy.
He's happy.
No, he's letting you know that he's happy and he just
Oh,
loves to be
hey,
himself.
Amari.
Okay, that's him communicating with you.
Amari.
Seriously, he's trying to let you know that he is happy, okay? So, I can see the gaps
Oh, stop.
where a Pediasure, I think, would come in handy
Thank you.
before the meal.
Yeah.
All right? That's what I came in with today. That's why I wrote down everything that I wrote.
Uh-huh.
I don't know if it's all to do with just not getting enough calories, as it may be something else physiologically wrong with him. Whether it's related to his brain, because he's had several seizures over the last 3 years, I think. He
Yeah.
got them late, right? And if you speak to a neurologist, they will tell you that over time, as they age, their brains change. Sometimes they do deteriorate. They prepared me for that, right? So maybe something's going on. Maybe something is going on in the brain where not only is it making the right side skinny as all heck, maybe now it's going towards the left side, so that no matter amount of food that you're feeding him, you're not going to fatten him up to be a little butterball. However, he's still growing in length, losing his teeth, and extremely active for 16 hours a day.
Yeah.
Okay? Seriously.
Yeah.
Now, or the other thing could be, as a surgeon, I don't know what it is, but I read an article where somebody wasn't able to gain weight, something to do with the intestinal areas, and they had to take out a certain part within the intestine,
Oh yeah.
and
Yeah.
once they took it out.
Not something that we obviously do.
I'm just
We
saying.
do the bones and stuff like
No,
that.
it was something to do with the intestine. As a doctor,
It was
you
a
should
bowel
be thinking outside the box.
Yeah. Yeah.
Right? This is where you can think outside the box. I can't think outside the box. I can only come to you what I think.
We tend to, because we're bone surgeons, so we tend to focus on the lower limb
Right.
fractures.
And you
things
made
like
the
that.
nutrition cry.
Yeah.
Nutritionist
So-
cry.
You know, she's a mature woman. She's fine. She's a professional, okay?
So let me just so my understanding, 7 years of age now, we've had multiple pelvic x-rays over time.
Yep,
We know that there's a bit of migration of the
Yep.
hips. There's been discussions in the past about potential operations, or they've been offered, but there's no desire to have an operation.
which was an experimental, still on analyzing with the global study that you guys got going. I know the history of the program.
The what, sorry?
What Dr. McCurry was offering is connected to a global study. I know where it originated from. I know who supports it.
We've got the, you're right, the hip data registry is run from here.
And where?
From this
Give it
Yeah.
to him.
Well,
So we
it's
got,
a global study. It's just, yeah, I just didn't want that.
Yeah.
There was no guarantees.
That's fine. All we can do is kind of talk to you and
Right.
see how he's progressing and travelling and
Oh, he travels.
and
He
so
travels.
let me just ask a few questions. Do you think he's got any pain?
I don't think so.
No. When he gets a pain, it might be,
In his legs?
I feel like sometimes if they're crossed. You know
yeah,
what
if
I
he gets
mean?
them too gimped up, maybe.
Yeah.
But he gives them up. He can do this. I don't know how he does it.
And
On the couch.
so pain's not a big feature.
Not when he's doing that.
Yeah. And in terms of getting around,
He folds, turns himself over, flips himself, and then
is he in a
he's hanging up and he's grabbing and he's doing what he wants.
is he in a wheelchair?
No, he's on the couch.
No, we gave the wheelchair back. Sydney is on vacation and they're
Yeah.
giving us like it's like a chair. We had the tomato chair, but he
Yeah.
grew out of that one. So he's getting a different chair and a new stroller.
Yeah.
But she's on vacation.
Gotcha.
So we have to wait for
And
September.
where's home? Are you from in town or are you?
Sure.
Sorry.
I'm sorry. Okay, great. And so you're linked in with the OTs who specialise in chairs and so
Yeah,
forth.
yeah, yeah, yeah,
You've
yeah.
got all that covered.
Yeah.
And then from our perspective, we like to know how his joints are functioning, whether he's fitting into the chair, whether he's able to kind of move around with any space, whether he's got any pain, any problems.
Mhm.
We know that there are surgeries that can help with limb positioning to try and make things easier, like can it make it easier to change their diapers? Can it make it easier for them to fit into their chairs? Can it help with pain control? But we offer surgeries sometimes, and there's no, like you don't have to have a surgery. All we can do is make the recommendation for the offer, and then
I didn't want the pins
yeah,
for
fine.
8 months with no guarantees. He gave me the statistics. I was supposed to write it down and give him I haven't had a chance to do it. He walked me through it.
Good.
And I know the risk.
And
There's a 10% chance that he may not feel pain once his hip pops out, but we don't know that till that time comes.
it's true. Some dislocated hips are painless.
Yeah,
Some are painful.
yes.
The
I already
only
talked to,
Dr. Amari.
Alea
Yeah.
well,
Stop.
I also
Is
talked
it
to a
Maria or
Cindy. I also talked to OT, occupational therapist, I guess.
Yeah.
The one that's providing the chair for us. I asked her, I
Okay.
said, what's your opinion with these children with their hips popping out? Like, you deal with them, right? She said it can be painful for them, but they don't go for surgery right away. I guess it gets booked in, not under an emergency situation.
No, you're right, it's not an emergency
Yeah.
situation, but we do know that if the hip
Go get the
comes out and then stays out for a long period of time, then we kind of lose the window to do the operation and put it back in. And instead, sometimes you just have to cut the head
That's
out,
what he said, we just cut the bone and throw it in the
cut the
garbage.
bone out. But then there's some evidence to show that if you cut the head out and then don't put it back in, those children may have more pain than if you try and put it back in.
Personally, I'd like hip replacement, but you won't provide that as a service.
That's not something that's done for kids with this problem. That's for people who have arthritis.
I read a study, now mind you, the patients were older, they were in their early 20s, people that bedbound, cerebral palsy, and they did, because it wasn't recommended to do hip replacement for them because they can't stand up and do the therapy and all that crap, right? And the mortality rate was quite low compared to anything else that was out of the market, and the recovery rate was very fast for them with hip replacement, despite what other people would have to say.
So hip replacements in kids with cerebral palsy and conditions like cerebral palsy done in their second and their third decade of life, that's certainly a thing.
So like in their 20s and 30s,
Yeah,
okay?
that is potentially a thing, but is not offered by everyone. But it is not a routine form of treatment. And even those particular patients would often end up just having the head cut out.
Okay, so when you say head, you're talking about the ball of the
The
bone.
ball, yeah, the ball.
So they just, right, and then the bone just floats,
And the bone floats.
which could lead into
It is bothering you.
a few other issues.
Well, it's normally quite good at controlling bad pain. So we do it for pain.
I'm getting upset.
Right,
And if he has pain, then it has a fairly good rate at controlling pain.
to cut the bone, that is.
But we know that if you compare the operation to put the hip back in versus the operation to cut the ball out, there are more people where you cut the ball out who will have a bit of residual pain than patients when you put the hip back in.
Okay,
Yeah.
and if the hip pops out, you can't put it back in though, because I'm under the impression that that window of opportunity has been,
Oh yes, I can put him down. You wanna put the bars on?
You're going to do something with it?
No, I'm taking this girl.
Oh, sorry.
She's
here, you want me to hold it?
you take him.
Okay, so I'm under the
Sorry, she's
impression
making
that,
making noise.
I'm
I
under
wanted to have a
the
look at him
impression,
at
I'm
some
under the
stage.
impression that,
You got him, Mom?
I'm under the impression that, what do you call it? I'm under the impression that the window of opportunity to use these pins to put everything back into place is done and over with. And even if it was able to do it at this point, he's
Sorry,
too
Cody.
underway.
Now that's a true factor. He is.
Yeah, and I realize that.
Amari?
I-
Are you sensitive?
No, it's cold. Your hands are
Do
probably.
I have cold hands?
Yeah, you do.
Do you know what they say? Cold hands, warm heart.
Mm-hmm.
Does he ever have any AFOs for his leg?
He has the one, but he moves around so much that he just haven't been putting
And
it
is
on.
it the right side that is the one?
It's we have the one.
And what you're saying is
His
completely.
tibia got broken because he wrapped. Okay, I'm sorry.
We have to get him up to weight if we were to do anything.
Oh yes,
Yeah.
I know that.
Yeah.
I know that. You don't think I don't worry about
No,
this?
no, I'm just telling you what you already know.
Huh.
I'm saying that you are correct when you tell me that.
Yeah. But he's
Do you
doing.
ever have any problems with changing diapers?
He doesn't like his legs being spread open too
How
much.
far can you get his legs out?
Oh, it depends on how he's sitting.
Yeah, pretty low.
It's been like that for quite a while.
And
And
that's
he's getting, he doesn't like to be touched either, right? So he's getting picky now.
and how's his back? He's got no curve in his back.
Well,
Why don't we look while you're bending forward?
I don't know what you're looking for.
He's got a bit of a curve.
He's always been like that, though. He's always been like that. He's got no little butt.
You got no bite. Look, I think that.
Oh, hello.
Dr.
Hi,
Moore,
how are you?
Stressed out,
Well,
feeding tubes, and just everything in general.
don't need to stress out. It's basically
Yeah?
I'm back.
Oh, you're a tough old bird, boy. You're a tough young bird. You're not
I'm
old yet.
I'm fine.
I know you're fine.
Yeah.
You're fine. I'm sorry. I'm just 5 kids.
You don't need to
I
be
raised
sorry.
5 kids. She's my baby.
Yeah.
See, she's, oh boy, she was the only one who had tantrums.
Yeah.
He's 14. What do you think I get now? He's my
so
grandson.
doesn't
Yeah.
want
He's in my care.
Yeah.
Yeah, all over again. I'm 63.
Yeah.
With Amari.
Thank you, thank you.
That's okay.
Here,
So,
just come sit in the corner. Sit over there.
When-
You guys will take a bath when you come home.
So look,
Okay.
thanks for being here. Anything we do is for his
I know
health
that.
improvement.
We know each other.
Yeah, and but what we say, not all parents wanna go with the treatment we suggest for various reasons.
Okay, and?
Okay, and we respect that. So I think for you, whether it was a G-tube suggestion or X-ray,
Oh, yes, I'm
it's a
sorry about
conditional
that.
process.
Not today, though.
No.
You know, once a year maybe.
no, not even
I
that.
can't afford to have you get a fever.
No, so hear me out. So the question is, if we're not planning on doing hip reconstruction, there is no reason to get X-ray. You only monitor when you reach a point where you need to intervene. We've already said that we need to put the sit back in. If you choose not to have that done, then I think we will need to see when you wanna come and see us for a reason.
Okay, well, last time I was here, you were gonna hook me up with a doctor and a nurse. That never manifested, by the way.
Oh, complex care. He's on the
Nobody
wait
ever
list.
called.
He's on the wait list. That's why they haven't
Oh,
called.
that's fine, because we've got, whatever.
Yeah.
And in regards to, I mean, like, he can't, I even canceled his circumcision because he's underweight. I was gonna get him circumcised.
Yeah, well, if he's underweight,
And they need
then
to-
we have
they
the
need to-
experts,
they-
dietitians here
Yes, I
to
understand
help
that.
improve their weight.
Yes, I
right?
understand that, but when you're giving me a solution that actually has no guarantee of anything outside of what I'm already going through is not a solution. especially when he eats and has a good appetite, and I'm willing to bring back
Yep.
the supplemental
We can do
drinks,
that for sure.
right, between 1 to 4, and I wrote down, I'm sorry, that's what.
I'm okay, I'm
And I
fine.
wrote down
Yeah.
specifically to show where the gaps were, so that, you know, what
Got
I don't see, maybe you can
Yeah,
see.
and I got the
And we
photocopy.
can, and we can build in,
Yeah.
well, you know, she's suggesting 2 Pediasures, I'm saying, no, that's too much, 1 and then a meal, maybe an hour after. You might say, no, he needs 2 and then an hour after, I don't know, I just know, I do not want a feeding tube because he is way too active, he's gonna pull it out. We're gonna be dealing with infections, and it's not what you think. He's not a child that just lays there and does nothing. He'll pull, he'll rap, he'll go like this, he'll go like that. Next thing you know, he's up like this. Like, this is not funny. This is what we deal with every day.
Yeah, no, that's why you have the
You see
best.
how fast I did that? That's what he does.
Give me back my money.
Yeah, you look back, next thing you know, he's turned around. Like, I was on
Yeah.
my bed. He was like almost, he was about to fall off. Like, I have a king size bed, imagine, you know what I mean? So,
Yeah, like,
he moves a
like, yeah.
lot.
So I'm gonna contact Dr. Ramesh,
Mhm.
and I'm gonna tell him that, you
I'll
know,
see him in a month.
yeah, we've talked. I would leave him to continue to follow him,
Yeah,
and if anything changes, you decide to have surgery done, or pain or something comes up,
well, you'd be the first person you call. We love you.
otherwise,
We just don't
there
necessarily
is no
agree with
reason
everything
for
you
you to
want.
come. But all the kids wait here 3 hours to see me for 10 minutes. There is no point coming here. If you're not having X-ray done,
Well,
you're
not
not
this
gonna.
time, next time. I'll tell you why. First of all, my house is extremely hot.
Yeah.
Like, we bake.
Sure.
Within the last 7 days, we just had a bout where he had 2 days without pooing. I mean, no food, right? And I honestly, I leave within a day and a half, he gets a fever, and he'll have it for 1 to 2 days.
I understand. So
So, you know, just with the weather, and he got back from the hospital, and I just thought this time we could bypass it. I'm working on it every 6-month interval with you. So last time we were here.
I will tell you when it's clinically indicated, when we need to have X-ray. If we are trying to put the hip back in, we should do an X-ray. If we have decided anyway we don't want to do surgery for one reason or the other, there's no reason to even X-ray him.
Okay, well, then that's fine, because we're not doing surgery right now,
Exactly. So,
unless I have to call
second
an
is,
emergency.
if you're not thinking of doing surgery,
No,
there is nothing I can offer to him
at this point.
at this point for you to come. So you already have 1 billion appointments
I
with
got that
different people.
mine.
To save you one appointment, I will write to Dr.
Can I
Ramesh.
ask you one question?
Yeah.
What took that, what's taken 7 years for it to get to this point?
Because you keep saying no. First you're okay, you might do it. Then
No, I
later-
never was
You're
agreed
like,
to
oh,
it.
maybe.
No,
You never
I
agreed to it,
never.
but you're like open
Look,
to it.
Just was wondering.
You said no, but I asked last time, do you wanna come back and have an X-ray done to have a rediscussion? And you said yes, and that's why you would book back
No,
here.
you didn't say that.
Yes.
Okay, well,
Not an X-ray.
Your daughter was there, we talked
I
very
just
clearly
thought it was
about this.
expected, I thought it was just a given that I was required to see you every 6 months. under
You're
the
not
at-home
required to see
program.
me if the decision is made
I
not to
thought
have
it fell under
surgery.
the at-home program.
Sorry?
I always thought it fell under the at-home program, it was just a requirement, I was obligated. I
You're,
always felt obligated to come and see you.
well, you're not obligated to come and see me.
Right?
I will
And it's
write,
no disrespect,
No.
because, right, we're dealing with a special needs child.
yes.
I just didn't agree with the treatment, because I would prefer a hip replacement. And I
Hip
said that
replacement is
to
not an
you.
option.
I know that, because they don't do it in British Columbia, Canada, correct?
Not that, I mean, for a young child, if it becomes painful in a year, no one would operate and do a hip replacement in a young child. Even the places, 2 or 3 places in the world that do well for cerebral palsy, they're for
remember I asked
17,
you about
18,
that.
19-year-old, not for a young child like this.
And why
What?
is that?
There's no technology, no implants, and they don't work well with someone you said, you won't
Moving
sit
around
still
like
and
that,
work.
yeah, so either or, the moving
Hip
around is a
replacement
problem.
is probably the worst option, it's
Okay,
not there, it's not
Okay,
gonna work,
okay,
right?
so I can put that to rest then.
Completely.
Okay, so the other thing would be then is when his hip finally does pop out, because more than likely it will.
Yeah.
Unless you operate like within the next 6
No,
months, to which
not
last time I
mine.
was here, you were grateful that you did not operate on him, considering the amount of weight that he was losing. Because you said that specifically, I'm glad I did not operate. So nothing has changed.
That is the reason why we have a dietitian and recommendations of dietitian, whether you like those recommendations or not.
Right,
The reason we have, and we're so grateful for her expertise, is to how to optimize this patient if I were to intervene.
but there are no guarantees. We're back to the
There is
no
no-
guarantees.
There is no guarantee on a lot of things, but we know medically
If you get
what
sick,
works.
now I know why.
And there is always a chance sometimes that
So,
things don't work.
okay, so I need to, what, do I have to read a million pages to see how feeding tubes work? Or is somebody gonna actually take the time to read for me and explain it where it just makes sense? Because to me, it does not make sense for a little boy that loves to eat.
So have they been referred to general surgery? No. So one of the things we could do is, the people that put those tubes, we can send a referral. Actually, I'm gonna suggest, because I'm actually gonna back off, I'm gonna have Dr. Ramesh organize all of that. My recommendation to Dr. Ramesh is gonna be that you be referred to a general surgeon for a consideration of feeding tube. So you have all the information of what's required. Your weight needs to be optimized, I mean, his weight for me to operate on it. At this point in time, you do not wanna have hip surgery done. So I see no reason why you need to come here to be followed up by
Okay,
me.
fair enough.
If new symptoms comes, things change from your point of view, I will see him in the next available visit. It could be 3 weeks from now if I'm in town, we'll make every accommodation to accommodate and see him here. But
Okay.
until that point in time, the ball is in Dr. Ramesh's court to work with you to figure out
Okay.
what's best for
Well,
you.
I figured if something happened in between the 6 months, because I do feel like it was obligated through the at-home program to be a part of this with you, right? And, okay? I just figured if his hip popped out, I'd go to the Surrey Memorial Hospital, they would call you, and you would do your magic.
No, I can't do a reconstruction.
I know that, I'm talking cut the bone, throw it in the garbage.
That's what you said.
That's what you said, that's the alternative. Or maybe he will just say no pain because you gave me that 10%.
It can
You
happen.
gave me
You
that
could,
10%.
for all you know, you could
And
have
then
no pain.
that's when you would come and say, well, we don't have to cut the bone because it is what it is. Or do we still have to cut the bone if it's not feeling
No,
pain?
if it's not in pain, don't touch it.
Okay, so I trust your better judgment on that. I just didn't want that for 8 months with all the risks associated with it, being that it was still a study to a global,
It is
whatever.
not a study. It is,
15 years old,
it,
15 going 18 now, right?
it's,
They're
this is
around for a while.
90% of the surgeons around the world, if the CEO,
Are they
grandson,
doing now?
they will do the surgery to put the hip back in.
But there's still
It's
no
not
guarantee.
experimental. It is not experimental
beyond that
surgery,
now.
yes.
Okay.
It is well thought out reason why these hips need to go in.
Okay, but there was a lot of complications and risk connected to it, and I just didn't feel comfortable.
100%, there are complications and risks with any surgery we do.
Exactly.
Yeah.
Well, it's always been contentious, as much as it is what it is. It's not easy, right? I wouldn't wish anyone to be in Amari's position. I feel like I'm the only one that really fights in this
Hey,
court.
stop biting your hand.
We are
Don't do
all
that.
fighting in this code.
Yes, but you fight for different reasons.
What reasons do you think?
I don't know, you're not there for the daily right.
No, I'm not there with him every day, but what do you think we as a team are here?
Well, for the medical, just, I don't know.
Stop
Just
doing
to
that.
move them on, so that they somewhat have a quality of
Why are
life.
you doing that?
No,
But
move
at the end,
on,
well,
we're
you know
here
what
to
I
give
mean,
them the best.
Don't do that.
That's what I mean, just,
Look, one thing I
help
wanna
them.
tell you, this team is here to give the best care we can for him and to support you as a family.
Yeah,
And
for
you've
all
done that,
disabled kids.
and you've done that,
That's all, I mean, we do, but it's still your decision for your child,
Yeah.
what you think is the best decision. And your primary, I would say, person that organized all of this is Dr. Ramesh. And he is ultimately responsible he made the referral to me, I've seen.
okay,
So if you don't wanna have the treatment or expertise that this team provides, it's back to him then to work with you, to support you, whatever your needs are, to take care of them.
Stop doing that.
like I said, I was under the impression I was obligated to
Nope, you're not
participate
obligated.
with this particular part of medical assistance under the at-home program.
And he said no, so
And
now we
I've
don't have
always
I know,
told you, I've
it's-
always
no.
told you, you're the most difficult one of all the doctors that I've ever had to deal with because you present the most pain.
Of
Even
course,
though you're
yeah.
trying to prevent pain,
Yes.
you're the one
Okay,
that
we go
presents the most
100%. I cause a lot of pain now to prevent future pain,
Right,
which is hard for families to accept in a child that doesn't have pain. Why would I go through 8 months of pain to
With me.
possibly avoid pain down the road? But trust me, that's done with
Pick up the crayons.
good body of evidence as it exists right now. Not just me, 90% of the surgeons around the world, or maybe more, 90 is a conservative estimate, believe this is the right thing to do. And this team is here to
right.
help you navigate through that process.
Who's this lady?
Maria, you know me well.
I don't see very well.
Oh, I'm the physio.
For as loud as I can get.
I have known
It's
Amari
gorgeous.
since he first came to
And
our
what's your
clinic.
role?
I'm a physiotherapist here.
Physiotherapist. Okay.
Okay,
Are we good here?
fantastic.
So,
Okay,
can I just-
so,
Clarify, surveillance.
Sorry,
okay,
we're discharging.
Okay, so no more x-rays then?
Yeah, zero.
okay, and is there something you wanted to say?
Nope, no, I just wanted to clarify that. That's it.
Oh yeah, no, she thought there was x-rays because she's physio.
No more
In the
x-rays.
future.
Well,
Yes,
not
in the
now.
future. Thank you.
Yeah, yeah.
Only when they really need.
No,
they
Dr.
gave
Ramesh
you
will
two.
organize an x-ray
Pick the
when
garbage
he
up.
thinks
Don't
it's,
kick it.
you agree to have an x-ray to be done.
Thank you.
And based on that or any other new information,
He had two at the children's hospital, or at the Certain when he had
and
a
if
seizure.
he then feels like you need to come and see us, he will make that decision. And even organizing for G-Tube, those appointments, I will let him coordinate that with you.
Okay, but you know, with you suggesting that, he's gonna just put more pressure on me.
It's not pressure, he's your pediatrician. Whether he puts pressure or how he talks to you, I don't control any of that.
Okay,
I'm not putting any, one thing I want you to know, we're not putting any pressure on you.
okay,
We're telling you
right,
what's best for him as we medically
okay,
in our
and who's
expertise.
this?
I'm Sarah.
Sarah.
I met you also before.
And
I'm a
you're-
nurse here.
Your title?
I'm a nurse that works with Dr. Malpuri.
Okay, okay.
We're just all in here so we all hear the plan and we
Okay,
understand. how-
okay, so if an emergency happens, we have to go to Surrey Memorial or preferably the Royal Columbian,
Okay, you're
because
getting
I would
annoyed,
prefer
right?
that.
Or Dr. Ramesh if he's
Call
if
Dr.
he's
Ramesh, not
Yeah.
call you.
Oh, 100%, yeah, I mean him.
Yeah.
And then he needs to decide,
No, I'm
What's
saying
that?
if something, if
even
they
if
tell
the
me
hip
that-
pops out, he needs to decide with you what is it that you want, and then needs to communicate that with us. To say,
No, I'd be dealing with emergency doctors who'd be saying, who's the doctor? I'll say Dr. McCurry, call him.
sure,
That's exactly what I would tell him to do.
no problem. We'll be happy to
And
see.
that's when I'd expect you
You
to show
guys-
up and
Kyrie, the floor is dirty,
do
baby.
your magic,
That one, please.
whatever
Okay,
that
stop. Don't
magic
make
is.
it.
Whatever option we have available,
Yeah,
we'll provide the best care for him at that
at
point in
that,
time.
at that time, because it's,
Possibly not gonna be reconstructible anymore.
well,
Okay, Amari, I hear you.
Kyrie, please.
I'm not the only person in that
Get up.
position having to face that
Oh,
Okay,
yeah.
let him
quote
sit down.
unquote reality,
He's gonna get sick.
right?
Okay, thank you.
Okay, we can leave.
Judy, I'll request the Pediasure through the at-home program.
Okay, can we change the diaper size? Thank you so much.
I don't know, can,
You actually, I clarified with the at-home program, you actually can call them yourself.
I think last time you changed the diaper size for me.
oh, she said you can call them yourself?
You can call them
No, I
yourself
don't
to
want
do.
a chance.
Okay, so what size do you want?
Go back to 6. The
Go back to
7 he's leaking out too
Okay.
much with this, okay?
Okay, thank you.
Okay, no
All right.
problem.
So now, in terms of the
Am I
amount of
making up this
pictures,
stroller?
what?
Let's start with one. Let's start with
No,
one.
no. I wanna have the option of between, well,
Oh, you,
I
oh, in
think
terms
there
of
was-
requesting, I can request
Oh, wait,
4 a
please,
day,
Mama, move.
yeah.
but you don't have to use them all.
No, I'm thinking depending on how much he eats.
Yeah.
We discussed that.
Yeah,
Got my
absolutely.
piece of paper back?
Oh, no, I got it, all good.
They're full
Yeah.
of
It's like
energy.
cats
Give me
and
back
cats
the
and
book.
I
dogs.
did.
Mommy, eat the curry.
I don't, I'm not, I brought in, I had it with me when I brought it in.
Huh?
Oh, it's in my purse.
Yeah.
I'd like to have the option of between 1 and
They look
4,
after Amari.
depending
Yeah, they play.
Sounds good. So
how
I'll-
many calories I build in with the barleys, the
There's like cats and
lentils.
dogs with these two. He goes and on the
Get
ground.
more
makes
snacks
them
in
up.
between. I mean, obviously, if he's getting 1,800 to 2,000
I tell them,
calories a
like, he's older
day
than you.
in food,
Right.
if he's getting,
Yeah.
if I can get him up
I
to
tell them that
18 to
he's older than
2,000
that.
calories a day.
So they have to listen.
Okay,
the box.
last
Yeah.
time we spoke, you said 15,
And he probably
100.
needs, he might need more, yeah.
yeah. Okay, if we can get him up between 18 to 2,000 calories a day,
I don't
Chance
know.
of a feeding tube drops.
Not really recycling,
That's
but.
with food, right?
That's not recycling.
I
Yeah.
can't guarantee that,
Don't worry
but
about it.
Oh,
eventually,
Lord.
yes.
There's more important things
Yeah.
to worry about.
And it's
right
not,
now.
to be honest,
Wanna
it's
get
not
out
up
of
to
here.
me, it's
Yeah.
gonna be between you and Dr. Ramesh, is
Oh,
what
so
Dr.
the
Mulford.
battle's gonna be with Dr.
God.
Ramesh.
Yeah.
With the feeding tube.
Okay, Mom. Apologize
And
for
it
this
should
nice
not,
lady again.
should not be, you don't need to apologize, it's fine. And again, it should not be a battle, it's just, as I was explaining earlier, it's part of our job always to just
Yes,
present you with all the
yes.
options,
But you
okay?
came with no guarantees and a bunch of.
And unfortunately, nothing
What
is a
ifs.
guarantee.
Yes,
Yeah.
because like with the laxative. So you're thinking a teaspoon a day of
Yes,
the laxative.
try that.
You think
See
a
how
tablespoon a day is too much, or once every 2 days is too much?
You mean too little?
No. I hear so many different things.
Yeah,
Give them 3 tablespoons full cap every day until you clean them out, and then after that, it's either a tablespoon a day, every day, forever.
what I can do, so I have a handout that I can give you. I can email it to you, cause I have your email.
Yeah?
That goes over the different options for the dosing, and I think probably a discussion with Dr. Ramesh is gonna be best.
Yeah,
too.
well, because he said
the same thing.
he said a teaspoon a day. That's what he
He's
said.
saying a teaspoon.
Yes, that's what he said
One
too.
says teaspoon, one says tablespoon, one says 3 tablespoons.
I mean tablespoon.
A tablespoon a day,
Yeah. That's what he said.
every day.
Because she said once he clears it out, the diarrhea will stop. It'll be like more soft stools.
Yes,
Yeah.
At a tablespoon a day, every day.
Yeah. Just start with that and see.
start with that, see how it goes.
Thank you.
Okay, thank you.
We apologize
You don't,
again.
you don't need to apologize,
Are
all
you
good.
going to email
She's
me?
gonna email you.
Yes, I'm gonna email you the handout.
Would you like me to write it down?
She got it.
I got it,
Oh, you got it?
I got it.
Well, yes, because you emailed me.
I have your email.
Your,
Yeah.
Let them go, Mom.
Okay, okay, bye
Take care.
Judy, bye.
See you guys. Bye, Amari.
Let's go, Mom. Let's get out of here. I don't want to be in this hospital no more. Here.
Yes, we'll go get some.
An hour and 21 minutes.
Yes, Alemi,